Professor Ann McKee is a professor of neurology and pathology. She's the director of neuropathology core at the Boston University School of Medicine. She directs the neuropathology service for the New England Veterans Administration Medical Centers and also directs the brain banks for the Boston University Alzheimer's Disease Center and Framingham Heart Study. I don't even know how you have time to be here with all these directing. But thank you so much. And with her current work, what she does, which is fabulous, is on the long-term consequences of this repetitive head injury from contact sports and also from the military. So let's give her a great round of applause here, Professor Ann McKee.
Well, thank you. I'm delighted to be here this evening to give a Rhett talk. And I'm happy to show you the research that we've been doing at the CTE Center at Boston University and the VAs in Boston. So I was exposed to football at a fairly young age. I came from a football family. My brothers played football, my dad played football, everyone in my community played football. And I was the fifth of 5 children, and I wanted to be just like my next 2 brothers. I was a lot younger than the rest of my siblings. And so, I grew up idolizing football players. And because I lived in Appleton, Wisconsin, a small town right next to Green Bay, I understood from a very early age that football isn't just a sport, and it's not just a big business. It's actually a national identity, and it's certainly an identity for the place I grew up. CTE is not a new disease. Chronic traumatic encephalopathy was first described in 1928 by a pathologist, but he described the clinical symptoms that affected boxers that were generally poor boxers who took a lot of hits to the head. There are several symptoms that are common in CTE. It tends to present as sort of 2 basic groups. If it presents early in life, like age 35, it tends to present as a behavioral or mood disorder, irritability, aggression, assaultiveness, sometimes depression, and those folks can get into trouble with suicidality and drug abuse. If it presents later in life, generally in a person's 50s or 60s, it tends to present like a memory disorder, very similar to Alzheimer's disease, and evolves into a dementia. But of course, the longer the person lives, the more those 2 groups of symptoms overlaps, and most people develop elements of both. I'm a pathologist, and what I do is identify CTE at death, and the hallmarks of CTE are the development of this abnormal protein called tau inside nerve cells. Now, tau is normally in the nerve cell, but after trauma, it becomes abnormally phosphorylated, and it gets displaced and forms toxic fragments of tau that are localized inside nerve cells and their processes. And eventually, the tau builds up to such a point that the nerve cells die. The 2 features of CTE that distinguish it from all other tau-based diseases are the fact that, first of all, it's deposited in these very spotty areas of the brain. That is, it's deposited at what we call the valleys of the brain, or in between the gyri, in those sort of dot-like characteristics. The second feature that's unique to CTE and not found in any other neurodegeneration is that it's perivascular. So the earliest signs of CTE are found around small blood vessels, and also the small blood vessels at the depths of the sulcus. If you were to look at 2 brain slices, one from a normal individual and one from a person with CTE, and stain them identically, you could immediately see the CTE-affected tissue without even using a microscope, because the deposits of tau protein are so dense that you can actually pick them up grossly as these areas of brown discoloration between the cerebral gyri, in the frontal cortex, and very often in what we call the medial temporal lobe, the amygdala and hippocampus entorhinal cortex. I've been studying brains for some 25 years, and I've been studying the brains from the Framingham Heart Study for about 20 years. And as part of that study, I was very interested in tau protein from the beginning, and I was very interested in following very aged people to find out where tau is deposited in normal individuals. And what I found from that study is even if you live into your hundreds, 110, you never develop the tau deposits that I'm going to show you in CTE. So CTE is not a disease of aging. You could live to be 150 and you'd never develop CTE unless you were exposed to traumatic injury. Another thing that I want to point out is that CTE is not Alzheimer's disease. There's a lot of misconceptions about that. CTE has absolutely no beta amyloid in the early stages, and most cases have no beta amyloid. But Alzheimer's disease all has beta amyloid. In fact, you can't diagnose Alzheimer's disease without a substantial number of beta amyloid staining plaques. So there's no difficulty with this. CTE is quite distinct from Alzheimer's disease. Now, why is the tau in the deposited in the brain after trauma in those peculiar areas, those areas at the bottom of the gyri, those sulcal depths? Well, we think that really conforms to the mechanics of physical injury to the brain. That is, traumatic injury to the brain, the kind we're talking about, concussion and subconcussion, is really an acceleration, deceleration, rotational injury of the brain. And when you expose the brain to physical stress, the brain feels the stress in those crevices in the brain. This has been shown by individuals involved in biomechanical modeling, and they've also shown that the greatest stress that's felt in the brain is at the interface of two tissues of different viscoelastic properties. And that would explain also why the shearing strain and the greatest traumatic injury is experienced at the perivascular space, the interface of the blood vessel and the brain parenchyma. And then studies in animals, and this a miniature pig that has gyri, like humans, when you expose these miniature pigs to acceleration, deceleration injuries, you get injuries in these same locations. So the physics of the traumatic injury explain the locations of tau in this disease. Now, how is CTE related to subconcussion and concussion? That's a much more difficult area. But we do know that in all instances, CTE has been related to repeated what we call mild traumatic injury. And I can't read this from this angle, but Dr. Walter Koroshetz from the NINDS has said very emphatically that there's no wiggle room. We know CTE is caused by trauma, and that is the extent of it. So concussion and subconcussion are both this mild traumatic injury, this acceleration, deceleration, rotational injury. The only difference between subconcussion and concussion is whether the injury is severe enough to result in symptoms. So a concussion is symptomatic. You feel dizzy or have difficulty with balance, you see spots, you feel foggy. You know, the list is quite long, but a concussion is symptomatic. The difference between a concussion and a subconcussion is the subconcussion is asymptomatic. The person's not aware that they had the impact injury. And the real difficulty for football is not the concussive hits. We can identify concussion, we can manage concussion, but the difficulty with football is the subconcussive hits. And it's been estimated that a single lineman over the course of a single year will experience between 900 and 1,500 of these subconcussive hits. So if you think about a 10-year football career, that's tens of thousands of these mild traumatic injuries over a person's lifetime. When we look at the number of cases of football players in our TBI brain bank that we've accumulated over the last 7 years, we've looked at about 160 athletes, and quite a number of them, about 128 I believe, have been football players. And the really surprising statistic is that out of the 76 professional players, NFL players, 73 of them were found to have CTE. So that's an overwhelming percentage. Of course, this is a very biased sample, and it doesn't reflect what exists in living players, but still, it's a very worrisome number. Now, if I was just to show you what the people look, the individuals who have died and whose relatives have donated their brains to this study, this is just a small sampling of some of the individuals in our brain bank, and you'll see that most of them are male, many are quite young, some played high school sports, some college, some professional sports. And if you take those individuals and then look at a brain montage, it basically corresponds to this, with the earliest and most mild cases of CTE found in the younger athletes at the top, with single or just a few areas of injury. And then as the disease progresses, you get multiple spots, and these spots become confluent as the disease continues to progress, and it eventually involves greater and greater areas of the brain until in the latest stages of this disease, the tau protein and the neurodegeneration affects the entire brain. We divided the stages of CTE into 4 stages back in 2013, with stage 1 being the mildest stage and stage 4 being the most severe stage. I'm going to show you some examples of those in football players. This is an 18-year-old football player named Eric Pelly who died 10 days after his last concussion, very unexpectedly, and what we found in his brain was very early CTE. Here you can see these areas of abnormality, and when you look at them closely, they're centered on blood vessels, and there's a tremendous penumbra or corona of this abnormal tau protein. That's extremely unusual in an 18-year-old's brain. An 18-year-old brain should be absolutely pristine, and this is what it looks like at higher magnification, showing you that central arterial or small vessel, and then surrounded by these abnormal nerve cells containing abnormal tau protein. Here's a 25-year-old who took his own life at 25, but he only played high school level sports. His name was Joseph Chernak, and his story was that he played high school football, pole vaulting, and wrestling. And at the age of 19, he developed some personality changes. He went from his formerly very outgoing self to a depressed and withdrawn self. He had been a very smart individual, and he had difficulty holding down a job. And you can see in his brain he has innumerable tau deposits in his frontal lobes as well as his brainstem. We've seen it in another college-level football player. His name was Michael Keck. He developed problems while playing college football. He actually only played 3 years of Division I football because he was having such severe headaches and difficulty sleeping. But even though he quit playing football, his problems persisted. And when he died at the age of 25, we found areas of CTE in multiple areas of his brain, as you can see here. This is an older individual. This is a former NFL player, Dave Duerson, who you may have read about in the news reports, but he played 11 years for the Chicago Bears, and then notably he started having problems in his late 40s and ended up taking his own life by shooting himself in the chest after he had let his family know that he wanted his brain to be donated to be analyzed. We've also seen in a number of athletes, including football players, CTE associated with amyotrophic lateral sclerosis. We've got about 13 of these individuals at this point. And Chris and I were fortunate enough to talk to Ron Perriman, who played for Boston College. He called us because he had been diagnosed with ALS, and he thought it was related to brain trauma, and he had us come down and visit him. And then he called us 4 months later and said that he was going on a terminal wean and he wasn't expected to live through the weekend. And he wanted me to know that I should take his brain and spinal cord for analysis. And Ron Perriman died the next day. And here is his brain. And you can see, again, the lesions of CTE, the characteristic lesions in the brain of Ron Perriman. We know of other living athletes that we're worried have a CTE associated with ALS, like Kevin Turner, who used to play for the New England Patriots, was diagnosed about 3 years ago. And there's at least 6 individuals who are former NFL players who have come down with ALS at exceedingly young ages that we're also quite worried have CTE plus ALS. So what do we know at this point? We know that CTE is a neurodegenerative disease associated with trauma. We've seen it in a number of football players as well as other athletes and military veterans. We know that it's not aging, it's not Alzheimer's disease, and it starts out as small focal spots, but with time involves the entire brain. There's a lot that we don't understand about CTE, and this is really just the beginning. One of the most notable things is that we don't understand how to diagnose it, and we can't diagnose it at this point in living players. In terms of concussion and subconcussion, as I said previously, we can manage concussion. It's the subconcussive hit that's an inherent part of football that I think is the most disturbing. So when I'm asked what is the future of football, I'd have to tell you I don't know. I have no idea. But I can tell you from my vantage point, where I listen to the tragic stories of anguished parents and spouses and siblings, and even just today talk to a man in his 50s who has disabling headaches, has had the will to get off an opiate addiction, but is having tremendous difficulties with sleeping and other things that we take for granted in life. I think it's time that we seriously reconsider football, and I can't say that I can responsibly encourage our young athletes to play football any longer. Anyway, I want to thank all the individuals that work with me at Boston University and the VAs, and our sponsors that have given us funding for this work, including the Department of Veterans Affairs and NIH. Thank you.
Hello? Hello? Yeah? Okay. So there was a football player by the name of Belcher. He played for the Kansas City Chiefs, and he ended up killing himself and his wife. Later was diagnosed to have CTE. Do you think any acts of aggression that we've seen now, maybe in the past couple of months in the NFL, are acts of aggression due to CTE, or is there any correlation with that?
We've seen a number of players who've been diagnosed with CTE at death who had long histories of violent aggression towards their family members. We've seen it in the boxers, we've seen it in football players. There's a number of anecdotes in many of their families, how they became assaultive with the development of symptoms from this disease. So yes, I think there's a high correlation of violent behavior in this disease.
Do you guys know if it's a self-perpetuating thing yet, or if you stop the frequent hits, the protein will stop developing in the brain?
Well, that's an excellent question, and it's difficult to solve in a human brain. There's certainly ethically you can't, and we can't identify it in living people, which is also an impediment. But the evidence suggests that even though the person stops the trauma, if they've already started developing it, if it's gotten to a certain stage, the process just keeps progressing even though they've given up exposure to the trauma. That is, the classic story of CTE is the person boxes or plays football until their early 30s, they retire, they're fine, and then later, mid-40s, 50s, they start developing symptoms, and those symptoms continue to progress and get worse, and at death we find CTE in the brain. So the presumption is once it reaches a critical threshold, it progresses on its own without further trauma.
Hello, thank you for speaking with us today. I kind of have a two-part question. The first part is, do you think that maybe they don't know specifically that it's CTE, but perhaps the victims, like I think you gave two examples of Ron Perry and Dave Duerman, that perhaps they know that it is a cognitive disorder because in both examples you gave, they said that they wanted their brains donated to science, and one young man also gave his spleen. And also, I guess the second part of my question is it only physical impacts that cause this disorder, or is there something outside of that, something genetic or some other causes for this disorder?
So we've never seen this disease in anything but exposure to trauma. Whether or not certain genetic risk factors play a role in susceptibility or resistance to the disease, that remains to be found out. And maybe there's other environmental factors that accelerate it or slow it down. But trauma is the single common denominator. And then the second question is, do I think people like Ron Perriman and Dave Duerson thought they had cognitive changes? Yes, I do. If you listen to these guys, if you take careful histories, they all know that they're just not quite right. They can't really put their finger on it. They have foggy thinking. They're doing things that they just know are not themselves, and their spouses say the same thing. So, and I think Dave Duerson's a really poignant example because he spent years on the NFLPA benefits board denying benefits to people who thought that memory problems weren't related to their years playing football. And then, ironically, he starts developing memory problems and other symptoms, and he wants his brain donated at the time of his death.
Question back here.
So I have a quick question, actually. Should I go? It's okay. Yeah, great talk. I'm in the front here if you're looking for me.
I don't know where you are.
Right here.
Oh,
Right here.
you're not that guy back
Oh,
there.
no, sorry. I was saying to the mic. I thought I could go. Quick question. Yeah, great talk, by the way. So you showed a lot of your images. You showed a lot of tau buildup and plaques in the cerebellum.
Just tau.
So tau buildup in the cerebellum. So I was wondering if there's pronounced motor deficits as a pathology in any of the people that you've studied?
The cerebellum is only involved really pretty advanced disease. So those motor deficits usually don't show up very advanced. You get dysarthria, you might have slowness of gait, rigidity. But the cerebellum in the football players tends to be a late stage disease, late stage change.
I have a question. Okay. So my question is, in terms of, have there been any genetic studies post-mortem? In the sense, have we been able to identify any sort of genetic? Because you said that after a certain point, there is the overexpression of tau, the hyperphosphorylation of tau is automatic. You said, right? And so, is there any difference in sort of in the?
No, it's an excellent question. It's very difficult to do genetic analyses with such a small group of people. Even 100 people is considered like 10 times smaller than what's necessary. We really need thousands of people to do a proper genetic analysis. And we're beginning. We're looking at things like ApoE4, and we haven't found a strong association, but there may be some association. We've looked for the mutations in ALS in the individuals who developed ALS. We haven't found them, but there's a lot more to do. I don't think we're going to find a tau mutation in these individuals. I think with enough trauma, almost all of us are susceptible to this illness.
And also, could there be any way that they could use some sort of modification or some algorithm of DTI imaging to be able to figure out where the tau would be most aggregated in a living person?
Yeah, no, DTI, we're doing it post-mortem as well as in living individuals. That really points out axonal injury in the white matter, and they're finding it. I can't tell you what it is right now. They haven't really shared all their results with me. And we're looking also for tau markers by imaging. So there are molecules that'll tag tau that'll light up on a PET scan. And so we're doing that too.
Thank you.
Thank you.